Hi everyone, good evening. Welcome back to our Nursing Guru channel. So today I'm here to discuss about our sixth semester subject. It is nursing management and leadership. So tomorrow you will be having a supplementary exam of your sixth semester. So this video will be very useful for you people to score more for your tomorrow's exam. So here I'm Ashita. So let's start our class. Let's begin with the syllabus review. So as you know that we will start with the syllabus review. After that each unit wise I'll be giving a important questions along with a syllabus review. So let us discuss with the nursing management and leadership. So the first unit is healthcare and development of nursing. So in this unit, healthcare and development of nursing services in India. So this unit, it is too familiar for you because you already studied this same content or the same topic in the community health nursing 1 in your 5th semester syllabus. So here you will be studying about the healthcare delivery systems in the each level. For example, from the sub centers or from the referral centers or from the district, from the state, from the country. So how the delivery care system, healthcare system, it is divided, how the services will be given to the population, that you are going to study. So in this, the recent trends in nursing services and management, it's very important from this unit. So you have to study about the definition of nursing management or nursing services and what is leadership. Then apart from that, you have to give a more focus on this current trends or the recent trends in the nursing services. This is very important in this unit. And the planning and development of nursing services, that is what I said, the healthcare delivery system in India, that is you have to study. Okay, so when it comes to the unit number 2, so the unit number 2 is management basic applied to nursing. So in this unit, so the management definition, what is nursing management definition you will be studying. Then concept and theories of management, it is very important. Definitely they will ask you this question for the 5 marks. Okay, you have to study this theories of management, like they will be asking define management and explain any theories of management, or like list down the theories of management and explain any one theory. That is very important. Then principles of management, it's very important. Like for example, principles like division of unity, based on the unity, based on the equality, based on the like the remuneration, based on the demand. So there are a lot of principles of management that you should study. Then what is the difference between management and administration? So that they definitely they will ask the difference between management or administration. They can ask, are like for a 2 marks question, or in the multiple choice question also they can ask this, define management or the administration. Okay, then the levels of management, what I said now, the principles, concept, theories and levels of management, it is very important that you should study. Then functions of management, you have studied this. Planning, organizing, staffing, controlling, or then post-com, directing, redirecting and budgeting. So this is very important. You should study the postcard. It's very important, the functions of management. Okay, this you have to study. There is a mnemonic, you can use this mnemonic and you can study the functions of management. It's very important. You have to give more focus on the principles, theories and functions of management. Then role of a nurse as a manager. Oh, this is also very important. Okay, being a nurse as a manager, what's her role? For example, doing planning of nursing services, or organizing the nursing faculties, or organizing the nursing services, then providing or care. So being a nurse manager, what is their role that is very very important, like supervising the people or the guiding the staffs or directing the staffs or supervising the staff, then coordination with the other departments. These are very important. Then building a coordination or the maintain standards of a profession. So there are a lot of role being a nurse manager that you should study. Next, in this, yeah, introduction to management process, that is what I said, the planning, organizing, staffing, controlling and directing. This is very important. This all these aspects you should study. Next, come to the management of nursing services. So in this, the third unit is planning nursing services. Unit number 3 is planning nursing services. So in this, what is planning, what are the visions of planning, what is the mission of planning, and what is the principles and objectives or philosophy of planning. Okay, this you have to study. Aims of planning or vision of planning or the mission of planning, that you have to study. Then types of planning is also important. Okay, then problem planning. So they'll be using that milestone chart or the Gantt chart. What is that Gantt chart or the milestone chart? They will ask for the 2 marks. Then next is the important thing in this, you are going to study about the budgeting. It's very important because they will be asking in the application level. Like for example, you are constructing an 50 or 25 bedded hospital. So how you'll be planning for the expenditures, or how you'll be planning for the budgeting of 25 bedded hospital or 50 bedded hospital or 30 bedded hospital. So in the application level, they will be asking this budgeting concept. It is very very important. You have to study this budgeting and planning. So in that budgeting, types of budgeting is important, definition, concept. It's a easy thing. Okay, like we are planning for a specific duration or for the specific period, we are planning our expenditure and the income. Okay, income or profit, what we call profit and expenditure, we are planning. So this is very important, you should study this also. Then budget proposal or the budget analysis, benefits analysis. Okay, this is very important. Next, unit number 4 is organizing. See, like the postcard, what you are studying, the principles or the levels of management, that is as divided into each unit. Okay, so that in depthly you are going to study in the every units of this management. Okay, so the fourth unit is what? Organizing. So in the organizing, yeah, sorry for the interruption. So for this class, Swarna ma'am is joining with me. Yeah, very soon. She is going to join with me now. Okay, until that we'll start. So organizing, the process of organization or the organizing, then you should know what is delegation and the coordination. Okay, delegation and coordination. Then here one more important topics may they ask, the hospital functions, types and organization. Okay, now continuation the Swarna ma'am will take. Okay.
Okay, so the organization we are discussing, this is the fourth unit. Already ma'am had told that organizing a process, assignment, delegation and coordination. Okay, so in the hospital, so everything will be on the basis of how we are organizing. Okay, so that is what administration will going to be teach you. Okay, so then in when it comes to this hospital, you have to know the types of hospital. Okay, so the next one is that functions and how organization will take place inside the hospital. Okay, so what is the authority and what is the process which will be taken place, that is you have to step by step you have to study that one. Okay, who are seeing this CET paper yesterday, most of the 5 marks question, 2 marks questions, what we have told,
Then we said that classroom management is important, that is in the 15 marks. Then OSCE. Specifically, we said that OSCE will be coming for your exam. So it is in your 15 marks question.
You go and
It's
tell your
completely our
juniors.
prediction.
The next one, then how organization development which will be taken place, the structure of the organization, and we have that certain organizational charts. Okay, so what is that organizing? Okay, one by one, suppose you are going to start one particular hospital,
Institution or the
yeah, or
hospital.
institution, so we may plan, okay, according
Like
to
for
that.
example,
Mm.
first in the hospital or in the college, chairperson will be there. Okay, or the chairman will be there.
Yes.
So under that, admin will come, or the administrators will come. Under that, principals of college or the hospital,
Vice principal.
nursing superintendent will come. When you are taking about the hospitals, then assistant will be there, deputy will be there, then assistant nursing superintendents will be there. Under them,
In charge will
in
come.
charges of each department will come. So everything will be in the organized way.
manner.
So when we are giving a nursing services, or when we are establishing a nursing institution or an organization, how it will be organized, that you have to study in this unit. Okay.
And next one is that effectiveness of organization, definitely. Okay, so this is one of the very important, and this one management is there, no, this will going to be helpful you till your lifelong. Okay, last breath it is going to be helpful, because if you excellence in this one while conducting the examination in the institutions, while conducting any kind of simulations in the hospital itself. Okay, so whatever you want to do, organization is very important. That effectiveness also study and go. And hospital administration, control, and line of authority. Okay,
This
so
is what I said now. This is
this is
line of authority. Okay, means the first priority or the authority who will be having the control over the organization or over the institution. So that you should know the line of authority. This is how the line of authority looks.
yeah.
Next,
This next one is that hospital statistics, including the hospital utilization.
so here in the hospital statistics, in the sense, like for example, the budgeting, what they plan, stats. Okay, then per day, how many patients are coming, IPDs, OPDs, the count of the patient, the statistics, birth and death. So how complete hospital statistics you have to study in this
what we
part.
will say in the vital statistics in community, no, same like that only. So the entire business has to run means, or the things which has to go in a cool way means, we have to get the particular one status. Okay, statistics is very important. The next one, nursing care delivery system and trends. Okay, so that is also because the ratio of the patient and nurse we have to manage in meanwhile, and the care of the delivery of care is will be so important to impact on the patients, to get the patients, because you know, if you are not providing a proper care, the patient will not going to come for our hospital. Okay, so the care, how, what kind of care the nurses has to deliver. Okay, if you go for NABH and multi-specialty hospital, you may feel the difference between the common hospitals. Okay, so the nurses are well educated, and as well as the quality of care they used to provide, it is so different. Okay, so comparatively you can see, so in the rural area and the urban area, you could have observe that, so that you study. And role of nurse in maintenance of the effective organizational climate. So the nurse will always play a organizer role. So whatever, for organizing the simple things also, she will be plays a important place. So that is why this is a very important focus more on the organizing. Okay, so the next one is that fifth unit.
This is very important unit. Unit number 5, it is staffing.
Yeah, it's staffing. Okay, so that already I have told in organization only, that we have to see the ratio of the patient and as well as the nurses. So we will start with the staffing.
Yeah, in that staffing, you have to study about the definition, components of staffing, then the philosophy or the principles of staffing. It is very important. Then objectives means obviously you will be knowing. So the manpower is very, very important to run an organization. So obviously the manpower, it's our staff. Okay, so what is the objectives? We will be doing all those work with the help of manpower. Okay, so that objectives you should study. Then here staffing, it's nothing but like selecting or the recruiting, collecting and placement of the staffs. Okay, that is recruitment process is there, that you should study. It is very important. Then after the recruitment, when the staff is placed, so after that the organization will be having an important role. So what is that important role? In the sense, training and staff development. Okay, this is very, very important.
Yeah.
Credentialing or retaining, promoting, transferring, terminating, superannuation. So all those things will be coming in this. Sometimes they'll be asking the 2 marks. You have to study all those terms. Okay, training, development, or training in the sense in the initial period they'll be giving a orientation to the staff, and they'll be having a 3 or 6 month of training. Okay, then staff development in the sense each week or the per day they'll be having a classes. Okay, they are just developing their staff skills and knowledge and attitude. Okay, next is retaining or the promoting when the performance appraisal is done. Okay, those who are performing well, those who are skills are very good, they'll be getting a promotion, so or they'll be transfer out or they will be retaining. Okay, that you should study.
See,
Then
because once you enter to the hospital, nobody will give you the chance to work. Okay, so first of all, you have to adjust for the atmosphere of the hospital. Okay, so whatever you study in the theory, it is a different, and practical is a very different thing. So that is why you have to focus more on this training, development, and after that, you will get the good positions. Okay, so promoting will be there. So there you have to focus more. Then listen, finish up. And then staffing units, projecting staffing requirements, a calculation of the requirements of the staff resources.
each
nurse-patient
department
ratio.
the vacancy is important. Okay, so in the departments wherever the vacancies there, wherever the placements they want, so that identification they have to do first. Based on that requirements they'll be recruiting the staff, that you have to study. Then
Categories of nursing personnel, including the job description that already ma'am has been told in the line. Okay, so
NS
DNS,
assistant nursing
Nursing
superintendent,
superintendent,
deputy,
deputy,
then
then
nursing
nursing
superintendent, nursing officer,
supervisor.
then supervisors, then in charges.
In charges will come.
Okay, all those nursing personnels, what is their qualification, what is their experience, and what's their job description. Nothing but what is their duties and roles or responsibilities. Okay, that you should study. It is very, very important. Okay.
Okay, so this one definitely they will ask for a 2 marks, or they will be asked for a 5 marks question. Sure, you will get this question. So the next one is that assignment and nursing care responsibilities. Whatever the role of nurse is there, no, that is your assignment. Task will come. Okay, so every day is not a Sunday, right? Same like that, each and every day you will get the different kinds of task. Okay, so eventually you have to educate yourself for your betterment of your progress in your career too. So that and all the work will come here. The next one is that turnover and absenteeism. Okay, which is that if you are absent, somebody else have to take care of your care. Okay, so that is a very important. That is why we have to work on the nurse patient ratio, and as well as the compensation of duties are very important. Okay,
Then
so
when it comes to this turnover, you should know the types of turnover. Okay, it is a voluntary turnover is there and involuntary turnover. Okay, like turnover is nothing but when the employees leave from the organization, there must be a replacement.
Actually,
of their
Arshita ma'am is
place.
not there means I have to replace her work. Okay, so if I am
New
take a leave means,
employee, new employee has to be replaced for their place for a specific period. Okay, that you should study. Then like for example voluntary in the sense like kind of resignation, completely they have resigned from their place.
particular.
Okay, then or the involuntary means from the organization the employee will be getting a leave, like for example a retirement or the death or termination. Okay, this is important, you have to study.
The next thing is that it is all about the
In-service
in-service education, and one more we left, that staff welfare and discipline and grievance. Okay, so this is the staff welfare is that see, we are providing lot of health related services, which means we are also having the what we will call that we used to provide like healthcare service, not benefits. Okay, so that benefits like in the form of insurance. Okay, in the form of PF,
health benefits for the healthcare workers.
Yeah, PF will be there. So for your welfare, at last you are going to be get retired from your job, means you will get a bit of amount, or as well as getting the healthcare insurance for your family members and as well as for you also. So those are the things which will be going to provide for your staff welfare. Okay, so that is the thing you have to study. Okay, next is that in-service education. So in-service education is that, see, this is the one of the very important thing we can able to upgrade our knowledge, and we will get a good kind of grade in our career.
See, by name itself you can understand. In service. I am in the service. I am getting a education. Means I am continuing with my education. I am continuing with my gaining knowledge, skills, everything. Okay, that is what we
To
called
promote
as
your job.
that is what we called as in service
Education.
This is very, very important. You have to study this.
So
What are the methods of in service education? Then principles of adult training or
then
learning.
nature
Okay.
and scope of in-service education program,
It's very important.
and principles of adult learning, and planning and organizing in-service educational program, methods, techniques and evaluation, and we have the preparation of report. Okay, so these are the things you have to focus more. Even while including the material resources and management, you have to focus more.
Material management, it's very important. Okay, material management in the sense like, first thing is procurement, purchasing, storing, collecting, and replacement. Okay, it is at the right time, right quantity or right quality is there or not, that you have to check at the right time, at the right place, at the right department, whether that equipments or the materials which is present or not, that you have to
control. Okay, so that is what the process of inventory
the role
control.
of nurse in the material management, they will ask, you have to study this.
Then here you have to focus more on the auditing and maintenance in the hospital and patient care unit. Okay, at last all these process auditing will come. Okay, so the entire process will be there in the auditing, that you have to focus more. Okay, let me move towards the next unit, unit number 6, which is directing and leading. So the directing and leading, here you have to focus more on the definition, principles of directing and elements of directing. Okay, so directing and leading. So what will going to be learned by this management means, that is one of the biggest good quality is leadership. Okay, so if you have the leadership, you can lead anything. So that will make you to capable for directing the things, and you will get the much more opportunities to grow your career. Okay, so the supervision and guidance there, and you have to participatory management, interprofessional collaboration, so which means we are going to be collaborate with our interprofessional.
It's not intra, it is inter. Okay, then
Hmm.
team management, assignments, rotations, duty rotations,
Duty
all
rota.
those you will be studying. Then maintenance of discipline in the hospital. Then role of nurse.
Yeah, role of
That
nurse.
is what the leadership quality.
Leadership in
Should have.
management. Okay, so this and all will show you the what are the qualities and characteristics of you as a leader. How can you able to directing the things to make that assignment to be fulfilled or to complete the particular task. Okay, assignment is nothing but the task, my dear student. So there, what are the qualities you should have, that you focus more. And this one, so you can remember this one in as a one concept. Okay, so we can expect from this 5 marks or 2 marks questions. Okay, what is directing, or what are the role of nurse in leadership. The next is that
leadership.
Yeah, leadership is that so related to this particular directing only. So here also you have to go through the definition, concepts of leadership,
then
and theories.
The leadership styles is very important. Okay, styles of leadership you have to study, that is situational leadership or the transformational leadership. Then methods of leadership development. Okay, to develop a quality of leadership, what methods we can use that
Then
you have to
mentorship,
study.
mentorship, perceptorship, and the next one is delegation, power and politics, empowerment, mentoring and coaching. See why? Because mentoring. Okay, so always the leader will going to be have a quality of mentor to provide a knowledge for their juniors. Okay, so because it's one of the very important thing as a leader. Okay, so she means I am leader or madam is leader, means she can't able to do all the work. Why she is having the leadership quality? She can able to
Delegate
get the
the
work.
like
Yeah,
division
of
work.
labor, that is very important. Okay, so if everything I can do, then why I want the staffing pattern? Okay, so that is not possible, no? So that leadership means in any kind of situation, they can able to manage the things to fulfill our job description. Okay, so or to fulfill the work assignment. That is what the things. And
next, decision making and problem solving skills that you already studied. It's a common
you
topic.
study nicely. Why? Because you know it will going to be helpful you to manage yourself in the working environment. Then
Next
conflict
is
management and negotiation, implementing planned change. Okay, so that is the thing. The next one is controlling. A lot of units are there, around 18. So we are in the 8th unit, that is what controlling. So implementing standards, policies, procedures, protocols, and we have the practices. So nursing performance audit. Okay, so audit is nothing but how you are performing.
nursing audit.
Yeah.
Okay, like the head of the departments or the nursing superintendent will be doing a rounds or the conducting audit based on your performance. They will be collecting a feedback from the patient, then from the other departments also, how your performance or how your skills. Okay, that is what we called as nursing audit. Then nursing rounds. So in the nursing rounds, they'll be checking about the quality of nursing care, how you are providing a care to the patient, that they are going to check in this. Then documentation or the records and reports, keeping records and reports is very important, that you should study. They can ask what are the types of records and reports. Okay, like you know that admission and discharge record, birth and death registers will be there. Then IP, OPD registers will be there. Then hospital budgeting register will be there, or hospital statistics registers. So all those, what are the records and reports will be maintained in the hospitals, that you should know it. Then quality management. Okay, or quality assurance, what we call it, is very very important. You should study this topic. Okay,
Yeah.
quality assurance.
They may
It's
ask
very important.
define quality assurance, like that 2 marks question far sure.
Or
may
they
ask
can ask in the 10 marks also.
so
We
we
cannot
cannot
predict
predict.
because it's very important topic. Then performance appraisal. This is also very important topic. The performance appraisal, it's nothing but the based on the staff skills or based on their performance, they'll be getting appraisal. Okay, nothing but they'll be getting a promotions or the demotions or the punishments or the transfer out. Okay, based on their performance.
Because now is ma'am join as a tutor. Okay, so once she is gaining more knowledge and experience based on her performance, she is going to be reach the level of principal. Okay, so that is her performance appraisal. Okay, so chairman will find it out their qualities and all. So chairman will going to provide in college side. Okay, in the same like in the hospital side, they will promote you as a in charge. Later they will be promote you as a supervisor. Okay, later on you will get the good positions. Okay, so that is what performance appraisal. The next one is that
benchmarking. Okay, this is also very important. These are the tools or the methods which we are using to assess the nurses or the staff's performance. Okay, benchmarking. So in this we will be identifying the gaps, where the gaps are present, why the quality of care is getting lack. So that you will be studying this benchmarking. It is very important. Study this particular topic. Okay, then like how to improve the like how to improve this quality of care, nursing care to the patient, then where they are getting lack, that you should study. Then activity plan or the same. Okay, the activity plan or the benchmarking you have to study. Then one more thing is PERT. Okay, program evaluation review technique. So this program evaluation review technique, it's like a project management tool. Okay, there'll be plan, schedule, coordinate and control the complex projects. Okay, by like what is required, each activity, how the activity is going on. So the whole project control will be they'll have. Okay,
next one is that the 9th unit, organizational behavior and human relations, HR. 9th unit, there is a certain concepts and theories of organizational behavior, group dynamics. This is very important.
group dynamics.
Yeah, group dynamics are very important. And we have the review of interpersonal relationship. Interpersonal relationship, it is not your personal relationship, the relationship which we can maintain with the patient and nurse. Okay, so that is what,
healthy relationship between the nurse and patient.
you
Okay,
should
that is
not
you
going
have
to
to
give
study.
your number, or you are not maintaining any kind of personal relationship with your patient. Okay, so only the thing, once you started the care, once the care will be wind up, your relationship will going to be wind it off. Okay, so same like teacher and student relationship will be there, no, same like that. You are not going to supposed to carry out for your home, till your home you are not supposed to carry that one. That is what interpersonal relationship, that is very important. And next one is human relations. So in that, public relations in the context of nursing.
Then relations with the professional association and the employee unions. Okay, that is also important. You have to study. Then one more important topic is collective bargaining, that they'll ask in the 2 marks. Okay, collective bargaining, it's nothing but the negotiation between the employees and the employer. Okay, so there is a team. The employer will be there and the employee will be there. They'll be started providing or giving a negotiation. It's nothing but they'll be discussing about the working hours, benefits, wages, or the salaries, then employee requirement. Okay, this is what we called as collective bargaining.
Okay,
What are the policies or the rules and regulations should be there in the for the employees? What are the salary will be fixed for them, and what is the working hours? What are the benefits will be provided in that organization? So that is what we called as collective bargaining.
So that is the thing. The next one is that we have
Motivation and moral building, that you will be studied in the psychology. Okay, motivation, theories of motivation you have to study. Then
and
communication in the workplace, this
assertive
also you have.
communication. Yeah.
No, okay, communication, it's
The
very
entire
important.
cycle is there, no, that you remember till your last breath. Okay, next
Next,
one,
committees.
importance in the organization functioning. Okay, so these are the very important from the 9th unit. Now we move towards the financial management, that we are going to study in the 10th unit. Unit number 10, we are going to study the financial management. So this is one of the very important. So here our exact things and calculation will going to be work it off. So that is what definitions of the financial management, objectives you have to study, elements, functions, principles, and scope. Financial management, if you study this much, 10 marks or 15 marks question they may ask, you can answer. Yeah,
nothing but this financial management. Okay, they will be asking budgeting plan for the each nursing departments, or financial management, or the financial planning.
Okay, so that
Both are
budget
same.
cycle is there, no, that steps and all will be there in one
Types,
particular
budgetary process, what we call. Okay, that is important. You should study this.
then financial audit. So at last it will come. Okay, so what is the expense and what is the expenditure, and as well as the what is the income and what is the loss or what is the profit. Okay, so that we are going to see at last in the financial audit. Okay, so this much if you study from this particular unit, so far more sure 5 marks we are expecting from this particular unit. Okay, so budgeting, don't leave. Okay, so budgeting is very very important, nothing but financial management. Okay, so that is the thing. Next we can move towards the 11th unit.
Informatics.
Yeah,
nursing information management. Okay, so in this you will be studying about the nursing records, then patient records, then use of computers in the hospital, how the softwares,
data,
health softwares, how it works in the hospital or in the college and in the community. It is very important. Then telemedicine, yesterday also I told this telemedicine or the telenursing. Okay, through the online the people are getting a consultation with the doctors for the particular disease or for the condition. Then electronic medical records, this is also I told that. Yeah, EMR. Okay, EMR, electronic medical record,
or they may ask EHR, electronics health record. Okay, both are same only.
Next unit, that is unit number 12. 11 is finished. 12,
personal management.
Personal management. So it's just a review of personal management, like stress and time management. This you already studied. Okay, stress adaptation and the management of stress. It may be work stress, or it may be your emotional, or it may be your personal stress. How you will be handling that in the hospital.
You are the nurses already, you taken oath, whatever it may be come also, we will definitely work for the society. Okay, so irrespective of our
Coming to
problem.
my commitment, so
Just-
I told.
so that is why you, whatever you will do, that only you
Okay,
write it
so
down.
this is what in the nursing service. Okay, whatever the units which we discuss now, this is in the hospital. Now the next part is management of nursing in the educational institution. See the postcard, what we discussed: the planning, organization, staffing, directing, controlling or coordinating, then recruiting and the budgeting. So all those again you will be studying in the institution. So it is a different kind of way. So whatever the budget plan, what you will do to construct the hospital, so here the different is you will be planning to construct your organization.
Yeah, one
or the
institution. Okay, so that is all about the, so one is for hospital.
Huh.
Till now we have discussed till the personal management unit number 12 we have discussed for the hospital. Okay, now we can move towards the institutional management. Okay, so there what you are going to study in the 13th unit, establishment of nursing educational institution. Okay,
So to establish, for example, now we are in the India, obviously when we have to establish an institution, so we have to follow the norms and guidelines of INC, okay, Indian Nursing Council.
see, you remember this one. Now ma'am is going to open one new college. Okay, suppose you think like that. So by the time what ma'am will going to do first? First
I
she-
have to study what are the norms, guidelines. If I have to construct an institution, what norms should be there? What
Norms,
guidelines I should follow?
Yeah, norms are nothing but rules and regulations. Okay, so what ma'am has to follow, that she has to first study first.
Like for example, related to faculty norms or the physical infrastructure of the institution or the clinical facilities of that particular nursing college, then the budgeting or the curriculum implementation, the follow-up of that particular curriculum. So all those norms I have to study this. Okay, this is very important, you study. Then coordination with the regulatory bodies, that is what I said, the INC. Okay, or it may be your
State Nursing
State
Council. Okay,
Nursing
so
Council.
INC, KNC and your university is also one of the body, okay, authoritative body. So there whatever the things which will be there, that you have to focus more. Okay, so don't worry about that. So if you do one thing means easily you go open your syllabus, in the front 4 pages this only they have given. Okay, whatever the things we have to do, what is the infrastructure needed, that planning, once you study this is enough for you. And next one is that
affiliation and accreditation. This is very familiar word. I hope you know this. Okay, so here the accreditation, it's nothing but there is a formal process they will be conducting by the agencies. What we said, the regulatory bodies will be conducting to recognize, okay, or recognize the external agencies or the evaluate how the organization is or the how the education institution is. Okay, it's nothing but conducting inspection. Simple.
Yeah. So, you know, you're not having the accreditation or affiliation. You're not supposed to go and study in that particular institution. Why? Because, you know, so you have...
It must be recognized by the regulatory body. Either it's from the state or from the university or from the Indian Nursing Council. Okay, that you should study. What is accreditation and what is affiliation. Next unit is unit number 14, that is planning and organization. The same thing what you studied in the hospital services. So here what is the definition of planning, objectives of planning? There is a slight difference because you are studying about the educational institution, that was hospital. Okay, what is a mission and what is a vision of this? Like for example, if I'm opening an organization, what is my motto? That is what we called as vision and mission. Okay, in your colleges, everybody in front of your college or in the gate or in the reception area, they will written the vision of this college or the mission of this college. Like for example, we will be providing excellent education in the nursing. Yes. So like this. Okay.
And their motto is that they have to provide and promote the good nurses for the country. Okay, so that is how one of the vision and mission will be there for your chairman or your person. Okay, so that much only.
Next is organization structure of school or college. This is what I said, that chairperson will be there, then administrator, principal, vice principal, then associate professor, associate, then assistant, then lecturer, assistant lecturer, nursing tutors or the clinical instructors. So how the
line will
structure,
come.
authority,
Organization.
line of authority, it's you should learn. Then curriculum planning, this also yesterday we said that curriculum planning is very important. Okay, the development of curriculum planning or the steps or process of curriculum, it's nothing but your syllabus that you have to study. Then budget planning, so in the budget planning about the staff or the faculties, infrastructure. After the infrastructure, like the equipment is needed for that, how we will be planning for the budgeting. Then the labs, avh or the laboratory equipments, and this library books, stationaries, computers and their maintenance, and journals,
Yeah.
access of getting journals. So all those you have to study. Then infrastructure facilities, okay, the how many classrooms should be there, the hostel facilities for the students and the staff. Then library, lab, food, canteen, okay, computer lab. Then one more important thing is transportation facilities also. Okay, then records and reports of the students, that is same admission record, then health records of the students, all those you have to study. Then
Said lot
staff
of
record,
records will be
okay,
there.
staff health record,
Records.
so that you have to study. Then committees and functioning, see we'll be having a lot of committees. You may heard of this discipline committee, then cultural and sports committee, anti-ragging committee. Okay, so all those committees will be coming, and what is the roles of each committee? Around 10 to 11 committees will be there, so that you should study and remember this is very important, committees and their functioning. Then clinical experience, so in the clinical experience you will be studying about the clinical teaching methods, like for example what clinical teaching methods will be used. And being a nursing students, you have to take a seminar or the lecture class or the micro teaching or
Bedside
giving
teaching.
health educations, bedside teachings. So all this you will be studying this. Okay, next move to unit number 14. It is staffing and student selection.
Yeah.
Okay, staffing and
15th,
student.
unit number 15th is staffing and student selection.
Okay. Next, so in this staffing and student selection, so when it comes to the students selection, you have to study about the student requirement, admission process, then clinical placement of the students. Then important thing is the staffing, the selection of the staffing or giving advertisement. First is identifying the vacant vacancy, where the vacancy we have in which department, that is important. After that, giving advertisement of that staff requirement, then conducting interviews, selecting the best employers, and giving the orientation to them, and after that training and placement. This you should study. Then after that, as you all know that it's a they can continue with the staff development program, and the performance appraisal will be there. Okay, next is the important thing, the staff welfare development program.
And as well as the student requirement and recruitment and admission and clinical placement. Okay, so that already madam told, that is the thing. Next one is 16th unit, directing and controlling. The same things what we have studied in the hospital, the same thing, a little bit of changes which will become in the institution. Okay, so
here they'll be having control and the they'll be directing the staffs and students, control over the curriculum.
Yeah.
Okay, so that you should study.
Because that is the main step, right? So that is there. And leadership and motivation and supervision of the staff as well as the students. Okay, so that will be there. Guidance and counseling, this is very important. Everyone should get the guidance as well as the counseling related to their job description, as well as their students, means they have to get the guidance and counseling regarding their course. Okay,
next is quality management. Okay, educational audit they will conduct, no, the same thing. Then program evaluation or evaluation of performance, that is what a performance appraisal. Next is institutional records, that we already told that what are the records and reports there will be there in the institutions, so that you have to study. Next is unit number 17, professional consideration. Okay, so in this professional consideration, you will be studying about the legal and ethical issues.
Yeah.
Okay, this is very important. Nursing as a profession, first nursing foundation, first year you have studied in the first sem and in the second sem. What is nursing? Nursing as a profession means how? What are the code of ethics? What are the legal issues will be faced? Like for example, informed consent, beneficence, tort, battery, All those you have to study in this. This is important, very important. Next is what is nursing practice, philosophy of nursing practice. Then what are the regulatory bodies? Okay, the, like for example, state nursing council, Indian nursing council, or the and their functions.
Yeah,
Okay,
constitutions and their functions
functions.
will be there. The next
Then
one,
according to this regulatory bodies, what are the code of ethics they have given, that you should study.
Okay,
Nothing
so
but the practice standards for the nurses, or the code
once
of ethics for the nurses.
once you study this INC, you complete all the things. Okay, code of ethics of INC. So that is how your time will going to be saved. Okay, so
Then patient rights, consumer protection act you should know, legal terms which is related to patient care,
the next one is types of
laws
law.
which is related to nursing practice, laws and legislations that you should study, like for example negligence of patient, malpractice of this one, then breach, then penalties.
Yeah.
So all those you have to study. Then this invasion of privacy, nothing but not maintaining a confidentiality,
Shality.
okay, of the patient personal information. Next is
Nursing regulatory mechanisms.
in that the registration, license, accreditation, affiliation,
Renewal.
how that renewal after like 2 years, 3 years, how the institution will be getting renewal or getting affiliations. Okay.
See,
Next.
every year they have to renew their programs and all. They have to tell to the authorized body. This is the process which will be taken place. That process you have to study. That's it. Next one is unit 18th. So the professional advancement. So this is very, very, very important. Continue nursing education will come. Okay, so
Continuing
this will
nursing education. See, nobody will start nowadays. Like when they complete GNM or BSc, soon after that they'll be jumping up for their master degrees. Is it like they'll be doing PCBSCs, or they'll be doing MSCs, or their degrees they'll be doing. So continuing nursing education, just they are upgrading their professional education. Then career opportunities.
Career
Yes.
opportunities will be like from we have a lot of advanced career opportunity in nursing. Either it may be in our nation or it may be in the outside of it. Global wise, our nursing will be have the good career opportunity. So that you study. Okay, so a lot of things are there in nursing that you may study that one. Next
Then
one.
the participation of nurse in the research. Then they should have a knowledge about what are the publications, journals, or the articles.
Girls, they can
Okay,
able
they
to-
should, being a nurse, we should participate in the conducting of research. And what are the journals or the publications is there that you should have aware of it,
Okay,
like
that
national, international publications, so that you should know. So that's all
That
about
is
the whole review of your nursing management. Don't worry, don't think that you have 18 units. Okay, the same thing, it's repeated.
Okay, same thing. One is
You have
hospital,
to study,
another one is
education
institution. Okay, so in 3 or 4 page we can make that notes. No worries in that. Why? Because now here also you make it off. Here also two part you do and do the short notes. And tomorrow morning wake up and nicely revise it and go and write the exam. If you study properly, all these things.
Okay, then one more thing, when you're answering for your questions, you have to be very specific with that question, what they have asked. Okay, why? Because sometimes you will be doing that, they asked about the educational institution, organization pattern, or some budgeting.
Yeah.
You will be writing about the hospital. Zero. Okay. You just read carefully what they have asked, whether it's in the institution or in the hospital.
Yeah.
Health service, it comes means you have to keep it in your mind, that is hospital. Okay, when it comes to education, it's a institution.
Okay, it's an organization, institution, like that. They may ask the question regarding the educational institution. Okay, so now madam will tell the important questions. Please take it down.
So yes, let me say the important questions. Long essays, take down. Define management, explain the functions of management. Okay, then define management, explain the principles of management. Then definition of planning, steps, types, and importance of planning.
Yeah.
Next, organizing, in that principle, process, and organizational structure.
Then staffing, recruitment, selection, placement, and orientation of staffing.
Next is leadership, styles of leadership, qualities of good leader. This is I said no, qualities of good leader is very important, and functions.
Functions, yeah.
Next is supervision, the principles, methods of supervision, then tools of good supervision.
Yeah. The next one we
Like
have
nothing but checklist, rating scales they will use. That is what.
the next one is that material management, and we have the methods of
inventory control. Yeah,
Okay.
I forgot to tell this. Inventory control is very important. ABC method we will use. Okay, ABC method, VED method. This you should keep it in your mind. ABC and VED analysis.
Yeah, budgeting, definition, principles, types, and as well as the budgetary process. Okay, so this is very, very important.
Then quality assurance in nursing service. What is nursing audit? Types of nursing audit and the process of nursing audit. Okay. Then what is performance appraisal? Methods and importance of performance appraisal. Then what are the philosophy, aims, and objectives of nursing education? In the first unit itself, I told you to study
that
this.
will come.
Then definition of curriculum, principles, and types. Then what is define lesson plan, principles, and format of lesson plan. Okay. Teaching methods and maxims of teaching. This they have asked in the PVBSC question in the afternoon. Today's class, maxims of teaching. Okay. It was in the today's exam.
Yeah, evaluation on nursing education principles, types, and tools. Okay, so this and all will comes under the institution part of the management and leadership. Okay, next one we have the short essay form of questions. So administration. So in the administration, we are expecting the definition, and we have the characteristics of administration.
Then decision making process, communication in management, delegation, coordination, time management, motivation, discipline, collective bargaining. Okay, in the nursing service. Then infection control committee, hospital committees, then accreditation, NABH, hospital accreditation. Okay, then records and reports. Continue nursing education means what? They'll ask like CNE. Okay, that is a short form. CNE, it's nothing but nursing education. Continuing nursing education. Next, staff development program. Then in that I said no, inventory control method, ABC method will be there, VED method, then FIFO method will be there. Okay, first out.
LTF.
Then tools used in the supervision, that is what? Rating scale, checklist, aptitude scale, tester. Then nursing rounds, guidance and counseling. Okay, then nursing audit means what? Budgeting, performance appraisal. Then what is orientation? The phases of orientation you have to study. Then pragmatism means
Pragmatism,
what?
yeah.
Okay.
Pragmatism is one of the important, and it will come in the
philosophy,
philosophy.
staff development, everything you have to study. So yeah, that's all about the important questions about this nursing management and leadership. Hope this video will be very useful for your tomorrow's exam. So if you already studied, just give a review of all those important questions what we said. So hope you'll get that same questions tomorrow.
Yeah, we are expecting. So yeah, God grace, if you get means it is good for you and for writing examination. So most of the important things only we have told in this only it will come. Okay, don't worry.
Okay, all the best for your exam. Thank you all.